Okay, everyone, welcome back. Today we are going to be talking about oxalates, and I'm really excited because this is a hot topic in the IC community. So to dive more into that, I thought that I'd bring on more of an expert than me because I am not really the oxalate expert at all. So today I have Melanie Betz with me. She is a kidney dietitian, and I'm just going to let you introduce yourself a little more, Melanie. Welcome.
Yeah. Thanks, Callie. I'm so excited to be here and chat with you. I think this is one area, oxalate is one area where we really overlap with IC and kidney stones. So I am a dietitian, registered dietitian. I am certified in renal nutrition, and I have a special interest in kidney stones. You can check me out on Instagram at the Kidney Dietitian, and I have a very extensive blog. So if you have kidney disease yourself or have kidney stones, definitely check out my website, which is thekidneydietitian.org. And even if you don't, and you are very interested in oxalate, hence our discussion today, you can certainly check that out. There's a lot of information about oxalate on there as well.
Awesome. Yeah, you have so many good resources. And what led you into that specialty?
I feel like so many dietitians have this, story that's very touching. I literally just had found an opening at the University of Chicago. Gosh, like almost 6 years ago. And I had left academia and patient care and kind of missed that. And I was like, well, I can learn about kidneys. That's cool. And so I just literally took the position. But since then, I've really kind of fallen in love with it. And obviously, I've kind of run with it with the kidney dietitian. And now that's my full-time job. But yeah, I just love how nutrition and food impacts kidneys so directly. Obviously, I mean, nutrition arguably can impact every part of your body, but I don't know, I'm biased, but I think that, it's just so cool how literally everything we eat in some way, honestly, gets excreted through your urine, essentially, and feces as well. But I just think that it's so relevant and so interesting. It's a little nerdy. I feel like nephrology is maybe one of the nerdier specialties, and I like that. So yeah, I honestly just kind of fell into it, and I've just found it so interesting. And I feel like there's so much misinformation out there. And I know we've talked about this before. We did an Instagram live together. And so I just kind of feel passionately about putting good information out into the world that really kind of simplifies it. Because I think that kidney nutrition is it gets so nitpicky, like with oxalate, and we talk about potassium and all these things, but it really doesn't have to be so confusing. And so that's kind of one of the things that I love about it.
Mm-hmm. Yeah. And I think that my audience, the IC community, is really interested in what you have to say. And I thought a good place to start would be, can you walk us through, when you eat or drink something, like how do our kidneys get involved? And then how does that get excreted into urine?
Yeah, that is such a big question. There's so many things. I guess, like I said earlier, so literally everything that you eat has to get excreted from your body in some way. Obviously, some things that we eat, like fiber, a lot of the oxalate that we eat actually gets excreted in our feces. It doesn't ever get absorbed in our intestines, and it never sees our kidneys. But everything else, so like sodium and potassium and protein, the metabolism of all of those things, sort of the waste or byproducts of our body processing all of those things that we eat, is by and large excreted in our urine. I would say, so I'm sort of making up this percentage, but I would say at least like 90%, because certainly we lose some in via our respiratory system and sweat and those types of things, but most of it is going to get excreted in our urine. And so that's, how food is so important for kidneys and for kidney stones. When we talk about kidney stones, I talk a ton about our urine chemistry, because there's things that we can do with food and changing our diet to help change what is excreted in our urine and make kidney stones less likely. And so, yeah, it's, when you start to kind of think about food in that way, it really is obvious that nutrition has such a large impact on the kidney.
Mm-hmm. And can you talk about what the composition of urine is? Like what are the major things that are in urine?
Sure. So water is definitely the biggest one. Acid is going to be another big one. Urea, of course, is another big component, hence urine, the name. And that is a byproduct of waste. So urea is generated as a byproduct of just our body processing things normally. What else is in there? There's going to be a kind of like every nutrient that you can think of. So there's going to be potassium, magnesium, oxalate is going to be in there. That's one of those things that we'll talk about later, like has no function in our body. And so our bodies get rid of it in our urine. So yeah, there's endless things that you can find in your urine, truly.
Yeah, definitely. I wasn't planning on asking you about this, but it just popped into my head, with IC, there have been people who notice that when their urine is more acidic or more alkaline, that they have more symptoms. And so people think, I need to eat an alkaline diet, or I need to drink a ton of alkaline water. And can you talk about, what is your stance on those types of things? And, how do your kidneys, how do they factor into the pH of your urine? Can you kind of go into that?
Yes, this is a topic that I find actually fascinating and something I'm very passionate about. So, and especially since like alkaline water and alkaline diets is kind of like a buzzword. So it's kind of fun to talk about what that means. And there is some truth to it. So again, like your kidneys have to get rid of the waste of everything that you eat. And certain foods are going to produce more alkali or base, or like the opposite of acid, and other foods are going to produce more acid. But I think a very common misconception is that it's really more about the production and the metabolism of those foods, not so much the pH of the food themselves. So at a very high level, fruits and vegetables and plant proteins, so things like beans, nuts, seeds, and lentils, tend to produce alkali. They produce base. And so that's one of the reasons, this is going on a slight tangent, but one of the reasons that those foods tend to be so good for kidneys, because similar to IC, it sounds like, things that are produce acid tend to not be so great for these different conditions. So for both kidney stones and for kidney disease. So in general, fruits and vegetables all are going to produce alkali. On the flip side of that, animal proteins, so all animal proteins, things like beef, chicken, fish, and seafood, generally healthy food, certainly, but they do all produce acid. And so dietary patterns that are higher in those types of foods are going to produce more acid. So it's really kind of more of a balance in terms of your whole dietary pattern. So if you're more meat heavy, meat, chicken, seafood heavy, you're going to have a dietary pattern that produces acid. Whereas if you are more plant food heavy, fruits, vegetables, plant proteins, etc., you're going to produce more alkali. And nearly all of the acid or base that is produced from your diet is excreted in your kidneys. Your lungs have a lot to do with it as well, but most of it is sort of managed, and your body keeps that pH in a very, very tight level by excreting the extra alkali or acid in your urine. So did that make sense? Was that a good explanation? Okay, great. And so one of the things with kidney stones is that certain types of stones, specifically uric acid and calcium oxalate, are more likely to form in acidic urine. And so that's one of the reasons why a dietary pattern that's moderate in protein, I don't recommend a low protein for stones, but a moderate protein diet is going to help reduce the risk, because it's going to help bring that urine pH up into sort of our normal range of where we want to see it for stone prevention.
Okay. So can somebody eat a diet that does keep their urine more neutral? Is that possible?
Yeah, and I think absolutely. And that's why it's really important to know where you stand. So if, for most people, this whole alkaline diet thing doesn't really matter. Like if your body is working the way that it should, that's why you pee. Like it's to get rid of that extra acid, or that's why you breathe. It's to get rid of that extra acid, plus other things. So for most people, this really isn't a concern. But when your kidneys aren't functioning properly, or you're finding that you have issues, perhaps with IC, and you can talk about that more than I, or you have stones, because you have this low urine acid, then we can do things to kind of modify that urine pH. One thing that I didn't mention previously that I think is really important is when we talk about the quote pH of a food, it really has to do with that metabolism of the food, not the food itself. So like a tomato, for example, and I know that's something you talk a lot about in IC world, is acidic itself, right? That when you take a tomato, it's acidic, but it actually produces alkali. And so from a kidney standpoint, we talk about that being more base producing or alkali. And that's one of the reasons why alkaline water is so silly. Because alkaline water is water that has a high pH, which is how you measure acid base. And your stomach acid, I don't know exactly, but your stomach has a pH of like 3 or something, right? Do you remember from undergrad? I don't know. It's very, very acidic, way more acidic than anything you're going to eat. And so when we talk about the acid base of the actual food itself, it doesn't really matter because your stomach acid is going to neutralize anything, because that's what it should do. It has to do that to kind of break it down and metabolize it and digest it. So that's one of the reasons why alkaline water is really just kind of a waste of money, because we don't care about what the pH of the actual food or drink that you're eating is. It's more about the metabolism of that food.
Yeah, that makes sense. And this is such a interesting thing because the IC diet is low in acid. It's recommending to avoid those foods that are really high in acid. And that's interesting because the IC diet was created based off of like anecdotal data. And there isn't really like science behind it quite yet. So, I mean, do you have any thoughts on that? Like what could it be?
That's something I've honestly wondered since I've met you, and I know we haven't really talked about this yet. But it's kind of fascinating because people say that they see improvement, so that's totally valid, and we need to acknowledge that, especially since in IC that's essentially all the data that we have to help people. But it, maybe there's something else going on, because one of the things in the IC diet is tomatoes, correct?
To avoid, yeah.
To avoid, right. So, I wonder if there's something else going on, because a tomato, as far as I understand biology and physiology, is not going to make your urine more acidic. It's going to make it more alkaline, if anything. So it's an interesting phenomenon. I mean, I think it's super counterintuitive. I know you think you eat tomatoes, those are acidic, like that's going to make my urine more acidic, but that's not actually how it works. So maybe there's something else going on in tomatoes and the other quote acidic foods that is difficult for IC patients. I'm not really sure, but that's definitely an interesting question.
Definitely. I think about it like all day, every day. And the fact that it's not even just acidic urine, it's also alkaline urine. And a lot of people don't know that. If you're turning your urine too alkaline, that can also cause you to flare up. And so we want to try to have as neutral urine as possible. I think it's just a matter of like, how do we do that? Like, how much of a role does your diet play in that?
Yeah. And I think that's going to be really different for different people. So alkaline urine is also an issue for calcium phosphate stones specifically. And we know that high urine pH is kind of more of a genetic thing. And there's honestly not a lot that we can do to move the needle. You could technically eat a ton of meat and like take out fruits and vegetables, and that probably would make your urine more acidic, but that's probably going to cause other issues. So don't necessarily want to recommend that. So, I think it kind of depends on you. Like, I'm sure there's some people that can eat Doritos and hamburgers all day and like be totally fine and have urine that's totally fine and no issues. Whereas other people, obviously that's not going to make them feel super great. So I think it just has to be really individualized to each person.
Absolutely. Another really interesting thing that people do is when they're in a flare that typically is caused by something that they ate or, something related to food. Some people will drink 8 ounces of water that has a 1/4 teaspoon of baking soda in it. And they think that, or they say that that is really helpful for them. What are your thoughts on that?
That does make more sense to me. And baking soda is actually recommended for people with advanced kidney disease. And it's even prescribed sometimes. Because that is basically a really high dose of alkali or base. And so that will make your urine less acidic. And so it certainly makes sense to me that urine with more acid in it might have something to do with IC flares. And so that does make a lot of sense.
Okay.
Potentially,
Are there
from
any
again, from my
risks of
limited
doing that?
understanding of IC, but
Are there any like risks to the kidneys when you do that?
so baking soda has a ton of sodium in it. So I think, if you're just doing this on occasion when you have a flare, I think that high dose of sodium is not going to be a concern. But if this is something that you're doing consistently every single day, that is a really high dose of sodium that we might be concerned about. And also just general health, high blood pressure and heart health and that sort of thing. But I think if you're doing it, again, once in a while, I certainly, and especially if you see that that's helpful for you, I don't see any issues with that.
Okay. Yeah. Obviously talk to your doctor first. We always say that on here.
Yeah, certainly.
Yes. Okay, cool. So we can move past that pH discussion. Let's move into oxalates. So can you just, start us off with what are oxalates?
Yeah. So oxalate is a compound that's found in plant foods. So some of the foods that it's especially high in are things like spinach, Swiss chard, some types of beans, specifically like white beans, navy beans. And so it just exists in these foods. I think, and I haven't looked this up since we last talked, but I think it exists in plants because it's some sort of protective mechanism. Again, I'm not a plant dietitian, I'm not sure, but it exists in plants for some reason. And so we eat it in these healthy plant foods. And to us, there's no purpose. And so when we have high oxalate in our body, we know that does cause some issues. It can make kidney stones worse and potentially some other issues in some rare genetic conditions. But that's what oxalate is in a nutshell.
Okay. And why has a low oxalate diet become such a trendy thing in the world right now?
Yeah. Another big question. I think so it seems as though some people have taken some cell studies and some very small animal studies. And oxalate, for some reason, has been like this demonized thing that people have just said is causing every ailment under the sun. Some of those things do have some truth to it. Like oxalate does certainly play a role in kidney stones. However, we're not going to go into this because I could talk for 18,000 hours about this, but a low oxalate diet is not necessarily the best way to go about helping oxalate for those people. And we know that oxalate does play a role in, there's something called oxalate arthritis. And that can happen when oxalate is very, very high in people who have these very rare genetic conditions that basically your liver can't process oxalate appropriately. But for the vast majority of us, there's really no data to say that oxalate plays a role in near any other condition.
Yeah. And specifically, I see there is no research that I know about, or I don't think you know either. There's very minimal research, even with like vulvodynia. I originally thought that a low oxalate diet was the way to go. And then I kind of dove into the research, and the research is very minimal, and I don't necessarily support a low oxalate diet for vulvodynia or IC. I mean, with my clients, I take into account all factors, so their medical history, their food preferences, their lifestyle, things like that. And I want to help them through the elimination diet, and we collaborate on what that will look like for each person. And we want to do the least restrictive diet possible. And so I don't throw low oxalate at anybody until maybe they're done with their elimination phase of the elimination diet and they're not seeing any results at all. And if it's something that they want to do, I'm totally fine helping them with that, but that's not something that I really, come out and do with my clients. So that's kind of like my process behind it. But I do know that there are people in the IC community that swear by a low oxalate diet.
Yeah, I think your point of the least restrictive diet possible, I love that term because I also very much try to help my students find the least restrictive diet possible to help with stones. I think it's so easy for stones or IC to go out there, go online and be like, okay, oh my gosh, what is, and you're desperate, right? Like if both things suck, you really want to feel better. And so you go on, you think, and you get this like giant list of all these things that you're supposed to avoid, but chances are only like 3 of those or like 2% or whatever are really going to matter for you. And that's, the whole point of working with you and going through the elimination diet, or working with me and looking at your urine test and seeing what's really actually causing your stones. And I think my issue with the low oxalate diet is it really just reduces what our bodies do. So, we talked a little bit about, digestion and how what you eat ends up in your urine. And it's not that black and white, right? It's not like what you eat equals what's in your urine. Like what you eat, food has to go through that stomach acid. It has to get absorbed. That absorption stage is wildly complicated, right? Your gut microbiome is going to impact it. The types of foods that you eat, the forms of foods that you eat, the combination of foods that you eat, all of those things is going to impact what ends up in your body from the foods that you eat. Then after whatever it is you're eating gets absorbed, it has to get metabolized by your liver. And there's a gazillion things that could impact that. Different enzymes that you have or don't have, or vitamins that you have or don't have, all of those things kind of work together. And then after your liver does whatever it's going to do to what you ate, then is when it gets, then it goes through your blood, less happens there. And then eventually it gets excreted in your urine. And so a low oxalate diet really just kind of reduces that. It takes like, okay, well, oxalate is an issue for kidney stones or whatever. Let's take that out of the diet and that's going to fix it. And there's actually, even for kidney stones, there's no data that shows that a low oxalate diet equals less kidney stones. So that's the issue with taking these things and just applying it to everyone. It's just more complicated than that. You have to look at each person individually.
Yeah. Absolutely. I think my biggest pet peeve when seeing practitioners on social media, talk about low oxalate diet is a very small few people are like demonizing oxalates. And I don't think that that's appropriate for any sort of food group or nutrient. I think, balance is the biggest thing, right?
Right. For oxalate specifically, one of the most effective ways to reduce the amount of oxalate in your urine is to actually make sure that you're getting enough calcium. So, that's kind of bringing in your point of how it's so important to eat a balanced diet. So calcium loves to bind with oxalate. That's why calcium oxalate stones are by far the most common. And so if you are eating a diet that includes adequate calcium, that calcium is actually going to bind oxalate in your intestine, and then you poop out that oxalate instead of it getting absorbed into your body and eventually excreted in your urine. And so a much healthier, more balanced, health promoting way to go about, quote, managing oxalate is to just make sure that you're eating a balanced diet that includes some source of calcium, whatever that is for you. So
can you give a few examples of foods that are high in calcium?
Yeah. So for the vast majority of kidney stone people, the people with kidney stones, I recommend dairy. So unfortunately, there's really not that many good sources of dairy. So we've got milk, right? Yogurt, cheese, although we don't want to choose the very high sodium cheeses for people with stones, at least, because that's not great for people who have calcium-based stones. But I think that cheese, and specifically the lower sodium cheeses, can definitely be included. So things like goat cheese and ricotta is one of my favorites. I love making ricotta toast with some a little bit of honey and some pistachios is my very favorite breakfast.
That sounds really good.
So yeah, so I think that dairy is by and large the best source of calcium for most people. It's going to be the highest in calcium. It's the most bioavailable. Our bodies can use it the best. So that is my go-to source of calcium for most people.
Okay. And then if someone's dairy free, are there other options?
Yeah. So it's going to depend on the person. Obviously, so like plant-based milks are going to come into this conversation. For kidney stones, I prefer dairy because we know that calcium supplements actually raise urine calcium more than natural sources of dairy, or excuse me, of calcium. And so all plant-based milks are basically like taking a calcium supplement, because they're not going to be naturally high in calcium. They're supplemented, right? However, I fully acknowledge that not everyone can tolerate dairy or avoids it for other reasons, and that's totally cool. In that case, we could just choose maybe some plant milks that are going to be a little bit lower in oxalate. Because if I'm saying like, hey, like add a ton of this, I don't want to introduce this ginormous oxalate load in this quest for calcium. So there's ways that we can go about doing that. So yes, those are also an option. We were talking a little bit before we started recording about some of the plant sources of calcium. So things like broccoli and spinach, kale, all have a fair amount of calcium in them. But it is important to know that the calcium in those plant sources isn't nearly as bioavailable. Our bodies don't absorb it very well, primarily actually because those foods tend to have oxalate in them. And so that calcium is sort of bound up with that oxalate, so our bodies can absorb it very well. But, everyone is different. So if you have IC and kidney stones are not a concern and your urine calcium is totally fine, then like those plant-based milks wouldn't be an issue whatsoever. Again, everyone's different.
Mm-hmm. Yeah. And I've heard you mention urine testing a few times. What specific test are we talking about?
Yeah. So we talk about urine testing a ton in kidney stone world because there's this test called a 24-hour urine test with a kidney stone panel, which everyone, this is a PSA, everyone who has had more than one kidney stone should have had at some point in their care. Unfortunately, only 20% of people with stones get this test, despite it being recommended in the guidelines. But this test is going to measure how much oxalate is in your urine, how much calcium is in your urine, which is super important because high urine calcium is actually the #1 cause of stones, not high urine oxalate. The pH of your urine, like we talked about earlier, it's going to measure something called citrate. There's a whole bunch of stuff. And basically your dietitian and your doctor are going to look at that test and say, all right, what's kind of off in here? And that's going to tell us why you're forming stones. And then you're going to tailor that prevention plan to that urine chemistry.
Mm-hmm. Okay. So that's more for people who have had a history of kidney stones?
Yes. Correct. Yeah. Obviously it's not used in IC. I don't know of it being used in other conditions. There are some, I know that it's used sometimes in like bone disease, osteoporosis and stuff, because it really helps kind of measure your whole body pH, calcium buffer system. All of that is kind of very related. So I know that it's used sometimes in endocrine disorders as well.
Mm-hmm. Okay. Yeah. I don't know. I think basically like the main conclusion that we can draw from this conversation is IC needs more research in general, but
yes,
specifically, if we're noticing that a lot of people are having success following a low oxalate diet, I think that that's something that might be worth researching. And so I think we just need more research.
Yeah, agreed. And since there is no data to say that this low oxalate diet makes any difference, just saying that everyone with IC should follow a low oxalate diet is honestly harmful. Same thing with stones, because a low oxalate diet is going to take out a lot of foods that are really, really good for both conditions, I imagine.
Mm-hmm.
I know for stones, that's definitely true. And I know for general health, that's definitely true. In addition to just kind of making you a little bit miserable, right? Like
Yeah.
that's why I think, we're so passionate about finding that least restricted diet, like you mentioned. It's impossible and silly to, cut 18 million things out of your diet. You're not going to be able to do that for the rest of your life. You have to find something that really will work for you for any sort of chronic condition like IC or kidney stones.
Absolutely. It is all about quality of life. And, if someone tells you to never eat, chocolate, alcohol, coffee, citrus, tomatoes, all those fun, yummy
What's the point of
things.
living?
Exactly.
Seriously.
Exactly. And so when I see people that have been eating that way and avoiding those foods for like greater than 6 months, like I've talked to people who have been doing it for years. I'm like, this is not how you want to live.
No.
And a lot of people are restricting themselves and they don't need to be. I'm seeing so many, I worked with over 80 people in my Road to Remission program, and I'm seeing so many people that are coming out learning that they only have a handful of diet triggers and they can actually have like a glass of wine. They can have, their favorite food again. And it's like, you just need to go through that process and learn your body's response to certain foods and beverages. And after you know that, your confidence with eating will increase. You will be able to eat good food again. You'll be able to participate in social events. Like we live in such a food-centered society that it's like, if you can't have a whole list of things or like try to go out to a restaurant and order something, like it is almost impossible. And so that I'm so passionate about this. I'm starting to talk about it. That's how I know.
I know. And it's just because it's heartbreaking. And I see it so much in stones as well. It's so funny that, these are such different conditions, but I feel like there's a lot of overlap since we've been chatting. People are following such restricted diets without, in my case, it's all about looking at that urine test to see what actually is a concern for you. And 7 times out of 10, it's not oxalate ever. Like your oxalate was not high. It's a high urine calcium, which is a whole nother thing that we can work on. But I think our society has, and the wellness world has really reduced food to just nutrition. And we are both dietitians. We are obviously very passionate about nutrition. Nutrition is important, but food is so much more than nutrition. It is cultural and emotional and celebratory. And those are all really good things that we need to remember. Like you cannot never have chocolate again. You cannot never have spanakopita again. That's full of spinach. If that's something that you really love. Oh my gosh, spanakopita is delicious. It's like spinach pie. But so you just need to learn that one, it's totally okay to have everything sometimes, even for those things that might be triggering or something that is higher in oxalate.
And even though, like, sorry to interrupt, but like to learn what your triggers are, if you know that you can have a small amount of something, that goes a long way. If you know that you can have a glass of wine and you can take that with pre-leaf, which is a supplement that essentially neutralizes the acid, and it helps a lot of people, but that is going to just significantly improve your quality of life. Like it's incredible what learning your limits can do. Like there's loopholes around these things.
Yeah, knowledge is power, right? For stones, I always talk about how no one forms a kidney stone in one day. Like one piece of spinach pie is not going to give you a kidney stone. It's usually just eating a very high sodium diet and not having water for months and months and months. Like that is going to cause a stone potentially in susceptible populations. And so knowledge is power, right? Just kind of like you said, there's loopholes. If you do really want that spinach pie, you can maybe have a glass of milk with it, and that's going to help make that feel safer and help you maybe feel a little bit better about having it. Whatever the case may be, everyone's different, but I love how passionate you are, because I feel the same way about, food is just part of life. And I think, unfortunately, sometimes the wellness world has almost said that that's a bad thing, and it's not. Food should be celebrated.
I see so many people just demonizing food out there. It could be certain diets, it could be anything, and it's really sad. And with IC, I think it's really just a lack of education. And like when someone gets diagnosed, it's usually the doctor handing them the IC diet list, and then they're kind of like, good luck figuring this
Yep.
out on your own. I don't have time to explain this to you. I honestly don't think that a lot of doctors even realize that the IC diet shouldn't be followed forever, which is alarming, but that's besides the point. I just think that people don't know.
Yep. Knowledge. It's all about
So
education, which is why we're here.
exactly. That's why we're doing this podcast. I'm on TikTok trying to reach as many people as possible. Same thing with the Instagram and everything else that, I do and we do, is really just to spread that knowledge and help as many people as we possibly can.
Mm-hmm. Yeah. Stop that food fear. I talk about that a lot. People are so afraid to eat whatever it is, whether it's, the high oxalate food, the crappy list that your doctor gave you that, that is not even relevant for your situation,
Right.
or alcohol or whatever it is for IC, right? Like,
and for people with IC, if you stress yourself out of food fear, you can trigger a flare.
Yeah,
anyway. And
that.
It's not even the food that's triggering you, it's the stress. And it's hard to figure that out when you're just getting a flare after eating a food. And that is something that
You're
is
afraid.
to a lot of people. It's like the cycle that they get stuck in.
Yeah, that's an area I would really be interested in for stones. There are some small studies that shows that stress in general, like chronic stress, is associated with more kidney stones. And it actually can change your urine chemistry a little bit. So that stress is real. And so oftentimes stressing about eating something is way, way worse than just eating the something and enjoying it and moving on with your life.
Absolutely. Yeah. So if anybody's listening to this and, you're looking for guidance, doing an elimination diet, and you're looking for that support, check out my Road to Remission program. This is a shameless plug. We really help our clients, from the beginning to the very end, and we offer lifetime support, meaning you never get kicked out. We're always there for you. Since IC is a chronic illness, it is super great. Melanie, can you tell the listeners where you already told them your Instagram. So if somebody is listening and they have kidney stone issues, how can they work with you?
Absolutely. So all of my shameless plug. So I help people prevent kidney stones in Kidney Stone Nutrition School, where I teach you how to really dive into that 24-hour urine test. And if you haven't had a 24-hour urine test, I help you get that test from your doctor. And so I teach you how to really understand what those numbers mean and how you can improve them with nutrition. There's different levels, but if you join as a VIP, then you also get my feedback on that test. So if you just head to my website, which is thekidneydietitian.org, you can definitely find out more about that course, as well as, like I said, I really do have a very extensive blog with a ton of free information there. So if you want to check that out, and learn everything you need to know about kidney stones in general, definitely head to thekidneydietitian.org.
Perfect. I will link that in the show notes. And if anybody has a random question, can they reach out to you on Instagram?
Sure, absolutely. I'm always here.
Awesome. Well, thank you so much for coming and sharing your expert knowledge with us. We do appreciate it.
Yes, thank you so much for having me. It's always a pleasure.